Welcome to 843 TV. I'm your host, Kathryn Mademann.
And I'm Lisa Richardson, and we're excited to be at the Ridgeland Clinic of Volunteers in Medicine.
And this is a great clinic because they just reopened from COVID, and also they've done some renovations. They've received a large endowment, and there's so much interesting things going on. They have a gala coming up. So we're going to go inside and meet with Pam Toney, who is the executive director.
So stick around for this episode of 843 TV,
where communities come to speak.
.843 TV, where the Lowcountry comes to speak.
.843 TV,
where communities come to speak.
Welcome to 843 TV. We are so excited to be out in Ridgeland today at the Volunteers of Medicine, Bluffton Jasper Clinic. And joining us is fabulous Executive Director, Miss Pam Toney. Thanks for having us out here today.
Oh, thanks for coming. We're always excited to have you, and we love to show our clinics to the public, so thank you.
And that's the reason why we are here today, because even though this clinic's been here for 5 years, but there's been a lot going on, a lot of renovations and new equipment coming this way, so we want to talk about that. What do you think?
That's right. Well, when we started our Volunteers in Medicine in 2011, so this is our 10th year anniversary, as part of becoming a Volunteers in Medicine part of the organization, we knew that we had to come out here in Ridgeland. That was one of the stipulations to become a Volunteers in Medicine, to have a clinic in Ridgeland. So in 2015, we worked with Lisa Hayes, part of the Aspen Institute, and her project was to help us get this clinic started. So the first thing we did was do a community assessment to find out what was needed, and we realized that primary care was so important. So we were able to get this wonderful clinic, and through donations, especially through the Palmetto Electric Foundation, they gave us funding to be able to do the remodeling, and then the rest is sort of history. We were able to get this clinic going.
It's a very lovely place. It's very clean, neat, bright, open windows, and it's very welcoming. So talk about some of the services that you offer for the patients.
Well, we started pre-COVID. I think we always talk about pre-COVID and post-COVID
pre-COVID
at the
and
moment.
Post-COVID.
And pre-COVID, we had 2 family physicians that were here, and we were open 3 days a week. And then in February of last year, we had to close. And when we closed and we tried to get started again, we were limited with our volunteers, because our volunteers are all retired. They're older, and of course, so susceptible to COVID. And so we really struggled getting things started again. Our medical director, Dr. Kathleen Casey, is out here every Monday. And so that's sort of what we were doing. And in February, March, we had a wonderful anonymous donor that gave us $85,000 for our clinic. And one of the things we always wanted to do, was hire a staff here. We've had volunteers, and they've done an amazing job, but having someone that's paid here, that's responsible, we felt we really needed. And so we hired a wonderful nurse, Michelle Wallace, and then a fantastic interpreter and office staff, Raquel, and both of them are here now 3 days a week. I'm really big on collaborating, and so we collaborate with the Pregnancy Center of the Lowcountry, and they're here on Tuesdays. So we're open 4 days a week, just like we are in our Bluffton clinic.
That's terrific. So along with the services, so far now we have maternity, but if somebody can come for sutures, what kind of services can they come
Well, we
for?
do primary care, and so Dr. Casey does that. We also do GYN, pap tests, mammograms. We have an optometry clinic once a month and a cardiology clinic once a month. And we're about to start podiatry. And then what we're really excited about also is that as a result of this anonymous donation, we were able to get in touch with MUSC, and they very kindly have donated a telemedicine cart to us. And then this donation that we got was able to purchase peripherals for the cart. So we can have patients that come here to see our doctors in Bluffton. So that is another real huge benefit here to the clinic.
And you were showing me the telemedicine machine earlier, and that's so key right now. Just the virtual, the video, that's probably expanded your reach and just cut down on people having to travel.
That's correct. Well, we do telemedicine with MUSC in our Bluffton clinic for eye care, but we haven't done anything with primary care. We did have, as a result of COVID, we do sort of an internal telemedicine program, but we found that some of the limitations are that the doctors need to actually see the patient better. They need to hear their heartbeat.
Right.
They need to check their eyes. And with just a regular computer, that's not able to be done. But this telemedicine program, this telemedicine cart has the peripherals that are able to do the eye exams, and the doctor can actually hear heartbeats. And so, yeah, it's amazing.
That's
really
amazing
is.
technology.
It is. It is.
You know,
It is.
That's
It
wonderful.
really
And just to
is.
know it's here in the clinic too. You know, our technology is good. We are up to date. And,
It is.
You know, we're vibrant. So along with our new clinic, we have one in Bluffton as well. So
Right.
reciprocal back and forth, or are you keeping them independent with the doctors?
Well, the nice part about this is that we will see our Ridgeland patients here, so they don't have to travel. When we did our community assessment, that was one of the issues, that our transportation maybe in this area, while they try real hard, but it's very difficult to get patients to come to Bluffton from here. An example of this was a lady that had to come for GYN services, and she left at 6 o'clock in the morning for a 1:30 appointment, and then her ride didn't pick her back up again until 5. So she was actually on the road almost 12 hours for a half-hour appointment.
Wow.
So that's why this clinic is so important. Now we've got our GYN doctors that come here, and so she can come here for her annual exam.
Now, for those who may not know, if someone's interested, like, what is the procedure? You have got to be a registered patient.
Right, you need to live or work in Greater Bluffton or Jasper County. And again, this clinic, we try very hard to make sure that only Ridgeland patients come here, just because, again, that transportation thing, if we brought Bluffton patients here, we're sort of defeating the purpose. So this is a clinic for our Ridgeland patients. They can do patient intake here, which means we do that to see if they qualify. And then we assign them a doctor that comes here to the clinic so that they don't have to go to Bluffton. We also have a non-dispensing pharmacy, so we can fill their pharmacy needs here as well.
That's one-stop shopping.
It is.
That's
It is.
terrific.
It is.
Tell us about the patients in the community. I mean, obviously you did the test, you did the demographics of
Right.
what's the
That's
primary, is there something specific that was in mind when you thought about bringing a clinic this way?
Well, again, it's the transportation, that it was
Okay,
so
that's the
hard
reason
for
why.
our patients to come
Yeah.
all the way to Bluffton, because you realize that's almost a 60-mile round trip, especially if you're in the far corners of Jasper County. I mean, that's a long trip for people.
That's right.
Not only to find transportation, but then to pay for the gas to come out here. So that was our driving factor. And then also Volunteers in Medicine America wanted us to be here when we got our charter. That was one of the stipulations, that we also brought a free clinic here to
And since you
to
did,
Jasper.
since you reopened since COVID, how has everything been going? How many patients are you equipped to see each day?
We see about 10 to 12 patients on Mondays. We'll do intake for about 6 to 8 patients a week. When we have our GYN doctor here, he sees about 8. So we do 4-hour clinics, and so in 4 hours we'll usually see somewhere between 8 to 10 patients. We don't like to rush. This is a home for our patients. They tell us lots of things besides their health. And so we want to make sure that we have time for them, and that they understand that this is a true medical home for them, and that our volunteers care for them.
Could you tell us a little bit about the screening process? When
Yes.
somebody calls into the clinic, what would some of the questions they would be asked?
Again, you have to live or work in Greater Bluffton or Jasper County. You can make up to 250% of the poverty level. So a single person, that would be about $33,000 a year. It goes up in 10,000 increments just on an average, depending on the household. So 2 people in a household would be about $43,000.
Okay.
You can't have insurance. And so those are the main things. And what we can't do here at our clinic, then we refer out. And so we always pay for the first referral. If someone has a gastro issue, then we'll send them to a gastroenterologist and pay for that appointment. If they have to have additional eye care that we can't do here, again, we'll pay for that appointment. So we have wonderful collaboration with area doctors and facilities. And then, of course, again, if we can't service here, we can't do something at one one of our hospitals, then we send them to MUSC or Roper in Charleston.
So that's so great. If it's something you can't serve, then you help them. You get them started.
That's right. We don't leave them. We don't leave them at all. So.
And you mentioned something important in our last minute here, that patients tell you a lot of things. So besides the physical wellness, it's wellness, emotional and health wellness is very important these days. So it sounds like you're there to give them some guidance too and help them in some other ways that are beyond just the physical needs.
Well, last year at the height of COVID, we had a lot of patients that were lacking food. And so we started to give them cards to purchase food. And then I realized the cards that I were giving them probably didn't have enough money in them for all the food they needed. So we collaborated with Bluffton Self-Help, and they brought their truck to us once a month. And we paid what we would pay in those gift cards, we paid as a donation to Bluffton Self-Help, and then the food they got was 3 times what we were able to pay for. So
this is just terrific. I love how our community comes together, but we have so much more to talk about. So we'll be right back with more 843 TV.